Blind. My name is David Sherwood, in case you don't know me, and I'm the Administrative Director here at Montgomery County Association for the Blind. Before I introduce our wonderful speakers, I just have a couple of things to say about today's presentation. For those of you who don't know, this presentation is being recorded, and it will be available on the PAB SharePoint for the PAB member agencies to view and show to other groups and community members in the area. Our presentation time, we'll probably have about 50 minutes to an hour for the presentation. Our presenters will be presenting for 15 to 20 minutes, and then we're going to open it up to questions. So if everybody can please mute their microphones for the first 20 minutes of the presentation, and then we'll open it up to question and answers. Okay, so I'm going to introduce our speakers. I'm going to start with Greg Muniz, who's over there. Say hello.
Hello, everyone.
And Lynn Mayleaf.
Hi.
They're both from PMC Pharmacy, and they're going to be talking about the Script-A-Line program for the visually impaired. This particular product helps folks who are visually impaired with managing their medications if they have difficulties. Each of the agencies who are viewing this and others who aren't here have actually been mailed out this product so they can try it hands-on. Real quick, I just want to introduce Lynn. We have a special relationship with her. She's actually worked at the agency for 9 years, and she has 20 years of experience working with the visually impaired and disabled community. She has worked at the Center for Independent Living in Philadelphia, and she's currently working at Apple as a specialist. And she also teaches folks assistive technology. And Greg over here, he is the Director of Sales and Marketing for PMC Pharmacy. And just a quick heads up, our agency has seen their presentation several times, so we think it's a great show. And I also have to give a shout out to Mary Brucker, our caseworker, and she runs all our groups. I'll have to switch the video so you can see her, so she does a great job. So I'm going to pass it off to our colleagues here and staff. Okay.
Yep, come on up a little bit more. You're right about there.
Morning, everybody. Good morning. Really, really great to be here. We're really excited to present to you. David, thank you so much for getting this all set up and being such a gracious host for us today. And special huge thanks to Elaine Welsh. Elaine is a huge supporter of what we do, and she shares our vision in making this a great option to keep in your toolkit when you are working with your clients. This is something that hopefully you'll be as excited as we are about. Many of you may have seen us about a year ago. We did a presentation in Harrisburg with Elaine to the Executive Director Quarterly meeting. Some of you were on conference phone. The technology wasn't working on the phone too well, so a lot of you didn't hear us. So we're hoping today is a so much better opportunity to see what we do. And also, we just wanted to let you know that, as David said, we sent out packages to all of you to give you a hands-on experience during this presentation. If you did not receive your package, please let us know, and we will get one out to you immediately. So I am going to, for momentarily, I'm going to pass over to Greg.
I'm going to move Lynn back a little bit here. That will be the backup beep on the trash pack, right? So if you want to just sit down.
Okay.
There you go. Okay. So, hi, everyone. I'm going to back up so you can see me here. My name is Greg Muniz, and I'm the Director of Sales and Marketing at PMC Pharmacy. We probably met some of you throughout the last couple of years at some of the conventions and some of the presentations we've done. I thank you for inviting us in today to talk with you all. As Lynn mentioned, what we did is we sent out to everyone a Script-A-Line box, which you see here right in the front set up. It came to you flat with Tic Tacs in the front. There's nothing exciting in there other than fresh breath. So we sent that out to you the other day. We sent a little flyer to go with it that talks on one side about Script-A-Line and on the other side about the Vision Impaired program, the VIP program. We sent out a few testimonial letters. They're really the same thing. One has pictures and one does not. One is more for screen readers, and the other one, just has some nice pictures. But before I start, I would like to read These testimonials that we sent out, we've gotten a lot of wonderful feedback from some of our customers and some of these folks that you all might know. So I'd like to read a couple of these if you don't mind, and then we'll get started. This one is from Karen Rocky, and we met her at the PCB convention, about a year and a half, 2 years ago, I believe. She says, and I'm just going to read excerpts from it, but people may have heard about PMC Pharmacy's Script Line VIP program, but may not know how wonderful it really is. I truly feel that more people should be using this way of taking medications because nothing will be left out. And then she goes on to say at the end, I plan to advocate in Western PA for PMC Pharmacy and how Script Line VIP works. I'm telling you, it is marvelous, and I want people to know. Well, that makes us feel really good, I'll tell you. And this one comes from Irvin Sweet, who we met at the Lehigh Valley Center for Independent Living. Script Line VIP is an excellent program for the visually impaired. It keeps you on track as far as your timing of doses during the day, and it's a lot easier for me to travel with. I know which boxes are which because of the Braille labels. So that's just a couple. We'll talk to a few more customers along the way here, but what I wanted to just talk to you a little bit about, so as I said, my name is Greg Guinea. I'm from PMC Pharmacy, and we have been in chronic pain management for many years, probably 12 years at this point. About 3 years ago, we decided that there's a lot of folks out there that we're not helping if we're just talking about chronic pain management. So we decided to start working with opening this up to all patients, anybody who's on any medication whatsoever. And we've had a tremendous response to this. We're not an open-door pharmacy. We're not one of the big players like a CVS or Rite Aid where people walk in and they hand you the prescription. We're a pharmacy where people come in, they become patients. We get to know them. We get to know their doctors. We get to know all their specialists. We get to know the families. And we take care of them personally, develop a personal relationship with these folks. So it's a little bit different than what people might be used to. But what we decided to do is embark upon this program called Script Line, and you all have this box right here. Hopefully everybody's been able to set it up. The way this basically works, I have a little flyer for you here too, is we try to take this mess. I'll get a little closer to the screen on some of this. Let me see how I can do this here. This is what people are used to most often, and we usually show this with home health nurses, and they get quite a response because they're the ones that have to fill all these.
Describe what you're holding.
So this is all the pill bottles and the pill tender that people have to normally fill themselves. So if there's anybody on the call that is visually impaired, we have a Monday through or Sunday through Saturday pill container here with 2 times a day, and all the pill bottles that might be represented that people have to go to the pharmacy 3-4 times a month and get them filled and come back and pick them out and put them in the containers, and things end up all over the floor, and it's a whole mess. So we've really set out to solve this problem. And what we've done is we've come up with this program called Script Line. And the way this, I'm going to back up a little bit so you all can see me here, getting my head cut off. The way this works is all of the normal pill bottle labels are normally in here. Pill vial labels, so you can see everything that you should be seeing, all the detail, the doctor's names, the prescriptions, the strengths, all that kind of stuff. And then what we do is we put them in individual dose packs for the entire day. This one happens to be Friday, Saturday 8 a.m., Saturday 4 p.m., Saturday 10 p.m., Sunday, so on. So this goes on for the entire week and then for the entire month. So folks, and I'll just tear this off. If somebody's going out for the day, they just tear that off. They take their morning with them. They take their afternoon. They tear it open. It's very easy to open. I made the mistake on a call once of taking these out and throwing them in my mouth in front of like 30 home health nurses, and then I had all these Tic Tacs I didn't know what to do with for the next 5 minutes. So it's kind of funny, actually. But so this is kind of how the system works. We handle all the prescriptions from all the doctors. We take care of the patient from start to finish. We call them once a month. We make sure that nothing's changed. It's a very simple system to work with. And we actually have reached out to a lot of those patients recently, and we're getting a flood of positive feedback back that's going to be going on our website very shortly as well. But that being said, some of the benefits to this program, and I'm sure a lot of you, I'm going to put these Tic Tacs in my pocket, I'm sure a lot of you can see just with the folks that you work with, this can be a tremendous program. We haven't even gotten to the other side of the program yet where we discuss the visually impaired. But this program basically if I hit a couple of the highlights on this brochure that we sent you, we synchronize all the medications to start on the same day. That's a big deal. People end up running out of medication on a Tuesday. They get it filled, and they run out of one on a Friday. They get that filled. This process goes on for the entire month. So basically, we take all that guesswork and all that aggravation off their plate. We line all those start dates up to start on the same day, and then we provide it in this box once a month. So they never have to go to the pharmacy again. They don't have to worry about running out. If it's going to snow, we take care of that too. Recently, when we had the snow, you got everything you needed, right?
Yeah,
I think when we did it,
yeah.
we made sure that that's never an issue as well. Let's see here, improved health and safety, that's a big deal. We do a lot of work with the home health community. And folks don't always remember to take their medication. Sometimes it's a challenge. Did I take it? Did I not take it? I don't remember. You'd have to dump all the pills out in the bottle that remain and then count what's left to see if they remember to take it. So we're trying to make it so that it's foolproof. You just look at the time and day. It's all big, and you can probably see on the packets you all have, big bold print on the day, their name, the time. That seems to be the most important information. We have the color of the medication. We have the shape even. We have the prescribing doctor. We have the prescription number. Everything they need to know is on that packet. So when they take it out for the day, if they happen to go somewhere, they can see it all. Reduced burden upon caregivers is a big deal because there's a lot of folks that have to help other folks. And we're really trying to help people remain independent and remain safe and remain healthy. And this program really seems to be taking care of that. We also follow up once a month to make sure that everybody's on the same page. And one of the best parts that people always ask, and I'm sure you're all going to ask at the end, how much does it cost? We offer free delivery, and the program itself is actually free. There's no cost to do it. We're a closed-door pharmacy. We have no walk-in traffic. We don't have that same overhead that they might have. So we can offer this whole program really at no cost, other than, of course, the cost of the medication. Co-pays are the same. All that tends to be the same as well. So that being said, I'd like to talk about the next part, which is why you all came here today to see us. But before I do that, I'll get to that in a minute. I want to have Lynn come up and join me. And I'm going to help her so we this right here.
Okay.
So this young lady right here, who I happened to meet, about 2 years ago? I always say if I were to ever write a book, it would be entitled, "And Then I Met Lynn." So I had my whole life prior to meeting her, and I walk into the Apple store one day to buy a computer, and I will let Lynn tell you the rest of the story, but that's how the rest of this got started. So go ahead.
Thanks, Greg. I love it when he says that. So I'm a specialist at an Apple store. Greg came in to buy a computer. And after I sold him the computer, I said, "So what do you do for a living?" And he said, "I work for this pharmacy that has this amazing system. We just bought a really, really expensive machine that coordinates all your pills according to the time of day that you take them." And I just was inside. I was jumping up and down oh my God, this would be a godsend for people who are visually impaired and blind because we can't read the pill bottles. It's a nightmare you're transferring pills from bottles to cases and transporting pills. And I was just over the top excited. So shortly after that, Greg spoke to the president of PMC Pharmacy, Brian Dunleavy, and we all met and shared this huge passion to make this possible for the visually impaired and blind. So what I did is I formed a focus group in Philadelphia at Associated Services for the Blind, and we all sat in a conference room and we passed around the boxes and and what you're holding and how can we adapt this to the blind. So the first thing that I did when I felt the strip, so it's a long cellophane strip with perforation separating each packet. First thing I did was try and tear off a packet, and I couldn't find the perforation. So Greg came up with a great idea that I'm repositioning.
Sorry,
okay.
We realized that we were only seeing part of Lynn there. So
You don't want to see part of me. Okay.
You need to see all of it.
You need the full view. So what Greg did was came up with this great idea of notching each perforation in between each packet. So when you run your hand up the left side of the cellophane strip of packets, you just feel for the notch and pull. So that was our first adaptation. Then we came up with bump dots.
You know what, Lynn, if I may interrupt for 1 second, I apologize. How about we do this while you're talking about that? I'll show them right on.
Okay.
I'll step just step in front of you.
All right, so
So
Greg's
I'm
going to
just
show
gonna show them
you.
the notches, and these are probably in yours, folks. I'm sorry, man. Right on this side, right here, if you go up the side, you'll see these notches. They follow all the way up. So folks, when they need to see what time, they wouldn't be able to necessarily tell where a perforation is. So for the next time of day, they can feel it. Just tear it off right there.
And if I want to count how many packets I have left, I can do it by feeling for the notch. So anyway, since visually impaired or blind people are not going to see the wonderful information that's on all of those packets, what we decided to do was, instead of having a consecutive time of day, day of the week strip for 1 month in one box, what we did is we broke that out into separate boxes. Each box represents a separate time of day. So number 1 box, which Greg is showing you, has a 1 bump dot on the top, and it's a black bump dot, which is great because if you have low vision, you not only feel it, but you can see it. So then there's a big bold number 1 for people with low vision, and for those who read Braille, there's a Braille label saying dose 1. So that's the number 1 box, and all of the pills on that strip are only the first time of day pills. So I have this box in my kitchen. I wake up, have my breakfast, go over to my number 1 box, pull off my packet, and that's the pills I take in the morning. I have a number 2 box, which is what I take at bedtime, and that's in my bathroom. And so that has 2 bump dots, a big bold number 2, and for those who read Braille, the Braille label dose 2. And so, of course, all of the pills on that strip are 30 days worth of pills that I take at bedtime. Really cool thing is, because these are so portable, as Greg was describing how you can tear off a packet and go. So my favorite story about that is that I went away to guide dog school in Oregon, and instead of taking a bag full of pill bottles and whatever I would have needed in the past, all I did was I tore off 14, it's a 2-week program, so I tore off 14 packets on the strip and put it in an envelope, and for each of the 2 times a day I take medication. So I had 2 separate envelopes, which I labeled with rubber bands, but you can label it any way you want, safety pins, or I don't know, so many different ways. But if you take pills 4 times a day or more, we have a new system. We have a patent pending on a box that has 4 strips coming out of it with the number of bump dots, the number of the time of day, and the Braille label above each strip of the 4. So you will have options of whether you want all your pill times a day in 1 box with separate channels, or whether you want separate boxes where you can put them in different places in the house where you are during that time of day. So we have lots of options for you.
Wonderful. That's fantastic. Anything else?
Another thing that is really awesome, and you're going to hear this, it seems to be a running theme with myself and Testimonials, but people who have pets or guide dogs, one of the nightmare stories is when you're transferring your pills without this system, them falling on the floor and getting on the floor and trying to beat your dog or your cat or whatever animal you have to the pill. So that doesn't happen with this. Another thing I wanted to share is that Greg mentioned we've been around the state doing presentations and going to conferences. So we were at a Pennsylvania Council, the Blind Conference, and a couple comments. One woman came up to me and she said, with this system, I can live at home independently. I don't have to move into a home I was planning on doing. So this allows me to stay in my own home. So of course that made us feel really good to be able to do that for her. And then another woman told us that she had just accidentally went to her husband's pill bottle, took his pills by accident, and almost ended up in the hospital. And then a third story I wanted to share with you is what social workers have shared with us. We've done presentations to lots of groups of social workers, and some of the stories are, they go into their clients' homes and there's a bucket of pills with varying amounts, either no pills left in the bottles or partial pills, or, and when they're asked how they take them, they have no clue. So there's lots of stories. I'm sure people who are listening right now can think of lots of stories about how difficult it is to identify and manage your medications when you can't see what you're doing. So this takes all the worry out of that. And another awesome part of our program is that people that are on our system get a call about 2 weeks before their next pill boxes are going to arrive. Their next shipment's going to arrive from PMC Pharmacy, because we deliver UPS. So we're going to say, how are you doing? Do you have any questions? Are there any changes since last month? If so, we call their doctor and get the changes adjusted in the upcoming prescription, in their strips. And then we let them know what day to expect their shipment to come. So we're in touch all the time. They can talk to a pharmacist at that time, or as I said, we can call their doctor. So there's a lot of support all around. So a person is never alone in trying to figure out what they're going to do in how to take their medications and managing the medications safely and independently. Okay, so Greg.
Fantastic. Thank you so much.
You're welcome.
Thank you very much. We want to open this up to some questions in a moment, but I just have a couple things to cover real quick. And I apologize, my head's probably being cut off, so I'll back a little bit here. I just wanted to make one thing clear. On this box right here, the original one that I showed everyone, this is morning, noon, night for the entire month. So everything that somebody's on that can use this visually, everything's in the same box for the whole month. They may be on enough medication where it requires 2 boxes, but this is basically how that works for the entire month. What we did is we adapted this system to be this right here, where we separate out the dosing channels. So rather than all in one strip, they're separated by time of day. So I just want to make sure that that's clear. I don't think I made that clear at the outset. So before we get into the questions, I'd like to share a couple of more thoughts from some of the folks that are on the Scriptline VIP program throughout the state of Pennsylvania. The next one comes from Sue Lichtenfeld, who's the president of the PA Council of the Blind. And she has some wonderful things to say. I'll just share a couple of excerpts. With the Scriptline system, I don't have to put any extra effort into using my medication. I simply tear and take. Taking my medications has never been more convenient and hassle-free. And then also Michael Freeman, who we met at the Center for Vision Loss. I really like PMC Pharmacy's medication system for the visually impaired. It is very easy and much better than going to the local pharmacy. It is also very easy to travel with. I just tear off a few packets and go. Everything is packaged correctly, and I like that. So it's wonderful to hear that you're making an impact. We don't just, Lynn and I just don't get up and go to work every day. We have this, we're very fortunate to be able to also help people along the way. And we are so excited about this program. We're so proud of it. We thank you for listening. And what we'd like to do is open it at this point to questions. I don't know what anything we need to do. Can everybody hear us? Yeah.
Yeah.
Yeah, so if anybody has questions, you can just unmute your microphone and just go for it. So.
Oh, I have one.
Sure, go ahead.
Okay.
We have one locally here.
Here, Renee.
All right. I wanted to ask, what if you have insurance? Would that cover your medication, or if you're on Medicaid or something like that?
So yes, we cover. That's a great question. It's about insurance. What insurances do we handle?
Mm-hmm.
So we basically take all insurances, Medicare, Medicaid, workers' comp, all the big insurance companies. Insurance very rarely becomes an issue. The only time we run into a snag is with Cigna. We do take Cigna HealthSpring, but we don't take Cigna. And there's a lot of reasons surrounding that. But that may change at some point in the future. But beside that, we basically work with every insurance company. So all a patient or a customer in this case has to pay for is a standard copay. Copays are the same with us. People often are concerned about that. You know, will my copay change? Copays are set by the insurance companies. They're not really set locally at the pharmacy level. So if you look at the back of your insurance card, it'll always tell you what the copay is on whether it's a doctor visit or you'll have a prescription insurance plan as well, what those copays are as well. So that's not something we really determine or dictate. It's something that comes from the insurance company. Anyone else? Out in video conference land. All right, well, thank you everyone very, very much. We sincerely appreciate it. If you can think of any folks that you interact with on a daily basis that could use this, we'd be happy to help. We're very easy to work with. Have them give us a call. We'll talk them through it, see if it's a good fit for them. And we promise that it's a very easy system to use if we'll give it a try.
Yeah, I just wanted to say, we must have done a really good job explaining if you don't have any questions, but I will call you all in the next few weeks to see if you thought of any questions you might have. And if you would like to, if you've identified any of your clients that you might want to talk to us about, and then we can tell you how to get them started. Or we can talk to them individually, whatever works for you. Also, since this is archived, it would be really great if you want to show it during a staff meeting or a support group meeting, and we would be happy to be on conference call following the presentation to answer any questions. So that's something to think about. But while we were talking, hopefully you've had thoughts of people that you work with or you know, or family members even, that might benefit by this program. And Greg has two more.
Oh, yes, I would like
testimonials
to read, I'm sorry about that. In closing, we have two more. Lynn gave us a nice one on the back here. Actually, I'm not sure if you all have that, but since she works here, I figured you could read that anyway. Or she's probably said enough about it. We'd like to share one from Debbie Rozier, and we're starting about halfway in. In the evening, when taking my dogs out for the last time of night, I pull a pack off and take them as part of my evening regimen. There is no more opening 5 pill bottles each morning or sitting down and separating the pills for the week and ending up dropping some on the floor for the dog to get.
Yeah.
And I used to say that her dog Uri had the lowest cholesterol of any guide dog because he used to always eat her pills. And then she goes on to say that they take care of everything, and I just get the box on the day of delivery and switch out the boxes. And this leaves extra time to do the things in my life. Thank you, PMC. And the last one is from Maria Vasquez. We met her at the Center for Vision Loss. I love it. Script-Align VIP program is absolutely wonderful. The staff has always been so helpful and wonderful. I love that it has the big print braille and bump dots. Having a guide dog, I have less of a chance of dropping pills on the floor, which has happened before, and we just talked about that. I used to have to get on my hands and knees to find a pill, and it takes a long time to get back up. I strongly encourage anyone who is a vision impaired person to take full advantage of the Script-Align VIP program. It is a lifesaver and has been a godsend. Thanks, everyone.
Thank you very much.
I have one more.
Certainly.
Oh, we have one more
One
question.
question here at the table.
Yeah.
We have another question.
I wanted to know how I could get myself started. I mean, because right now, I get handled my medicine, but I want to be more independent where I can take my medicine by myself.
Right.
It's so easy.
So we have a client here at MCAB
Right.
in the support group who is asking how she can get started. So do you want to answer? Or do you want to
Yeah,
take it
and
offline?
you hit the nail on the head. That's what this program is about. It's about remaining independent,
Yeah.
taking your medication safely, not missing a dose. Certain medications you can miss a dose and start the next day. Certain ones you can't.
Right.
So we're here to help with that process. What we'll do is, before I leave, I'll get your name,
Okay.
and we'll have our customer service folks call you today or tomorrow,
Okay.
and just kind of walk you through the process. It's very simple. You just give us the names of your doctors. We call them, get the prescriptions transferred, and then we set you up.
Okay.
And there's a little, it might take a few weeks. We have to get the
Yeah,
medications
yeah.
lined up, and there's a little bit of a process on our end to make sure that we get everything started on the same
Oh,
day.
when you said a few weeks, so that mean I would be without my medicine?
No.
No.
Well,
good.
I'll tell you, if you really want it,
Alright.
so the detail, the way it works is, we're going to look at all of the start dates and end dates and start dates of all your prescriptions. And behind the scenes, we're going to find out how many you have left of one, how many you have left of another, and another, and another, and we're going to make sure you have enough in the interim so that you don't run out. And then we're going to look at a date down the road, say, okay, all your prescriptions are due to run out, and we're going to start you on April 19th, in the box, the way this is. So it's a very simple system here. Let me here you go. It's believe it or not, it's so simple. We're just going to, our customer service folks will walk you through the process.
That's how it feels. Okay.
Yeah, so you have bump dots and braille
Yeah, I felt them.
and different ways to read it.
So we have 100% interest here.
There you go.
We have one thing done
Yeah, we
and.
usually have quite a few questions, but we answered them all for you.
Hello,
Yes.
we have a question at BVRS. If the person has over-the-counter medications like vitamins, can they be put in the same packet?
Yes, as a matter of fact, as a courtesy, BVS, for people that are getting their medications, can also get their vitamins through PMC Pharmacy. We get a wholesale cost, so we pass that on to you. So we can put it in packets. The only one that's hard to put in packets is fish oil. So when I get my fish oil, because the pills are big and they're kind of hard to put in the packets with everything else, so we include the fish oil bottle at the wholesale cost in your shipment that is delivered to you. But we do get all of the vitamins and supplements at really low cost, and so that's really a bonus, and it's great quality. It would be similar to buying them at like a Costco.
Okay.
Who is that for BVS?
Martha, we're BVRS, Blind and Vision Rehabilitation Services.
Hi, Martha. Thanks for your question.
You bet. Anybody else have questions? No? We're good.
I'd like to ask something.
And who's
Okay, my name is Dawn. I wondered if the way I'm doing it now, I do it. I buy a 3-month supply. Is it possible to do that with your pharmacy, or is it just comes every month?
Certainly. Yeah, that really depends upon the insurance plan. And if the insurance plan dictates that you can do it in a 3-month supply, we can do it in a 3-month supply. You'll just get all your boxes at the same time.
Okay, thank you.
You're welcome. Great question.
I have a couple other points here in just looking at this flyer that I sent with everybody. One thing that is on this original packaging that I failed to mention, and my apologies, is we can put reminders in here. So let's say somebody takes insulin, or they have to take an inhaler, or whatever it might be for a certain time of day. It's not an oral medication. We actually can put a little reminder pack right in there that says, a little ribbon tied around the finger that says, don't forget to take your insulin, or don't forget to take your inhaler.
And for people who are blind, it could be an empty packet that we would discuss with you how you want us to remind you in that way. Another point which this brings up is that because we are a pharmacy, anything that you take that's not a medication, not a pill, so like an inhaler or insulin, we include that in the box. So that's definitely part of what we do. Also, sometimes people ask, what do you do for as needed pills? So if you take a pill just as needed, we would put that in a pill bottle in with your shipment, because you don't want that in a packet, because the things that go in the packets are pills that you're going to be taking every day.
Mm-hmm.
Right.
So
Yeah, so being in the chronic pain medication management business for, 12 years or so at this point, we've gotten very good at that system. Now, those typically have come in these types of bottles right here. And PRNs are quite frequent there.
what type of bottle is it?
The pill that's standard pill vials.
Okay.
So, but PRNs can't be put in this packaging because it just doesn't make sense. Like Coumadin or something like that couldn't be put in the packaging, but we supply Coumadin. I think folks tend to think that we only tend to do one type of medication. We do everything. Anything that you can possibly take as medication, whether it's an injectable, an inhaler, anything that you could take, we can do. The only thing we can't do is compounding, and we don't do specialty medications like, say, interferon or something like that. But anything else would come just in the UPS box, because we do deliver everything UPS. We're not a mail order pharmacy. Things don't just show up in the mail. Everything is very secure and it's trackable through UPS. and you get everything for that month or that. I think there was a question out there about the 3 months, you get everything in one box. Or it might end up being, 2 UPS boxes or something like that if it's enough. So, but yes, anything that is out there, we can do.
You talking about signing for it?
It does have to be signed for, yes, because it's kind of a holdover from our other side of the business, which is narcotics and prescription pain medications. That is very highly controlled, so we have an adult signature required on that, but we do have signature required on this as well. So, hopefully that answers that question. Let's see if there are any other things. Free delivery. We don't charge for the delivery, so that's a big deal for folks as well. Just see if there's anything on here.
Any other questions?
I had a question here.
Certainly. Mary has one.
Mary has one.
What I was wondering was, now, do you include the instructions or what side effects are listed of your medications?
Great question.
In accessible
So,
That's a great
in
question.
case you didn't hear, Mary wanted to know if we include all of the information about each drug. So you know how when you get it from the pharmacy, there's a sheet for each one to tell you what it is and side effects, things like that.
Yeah.
We have that
Very
inside the
nice
box. It's in the flap. Do you want to show?
You know what? I don't know. Yes, Lynn, this is actually,
These are mine
these are
pills.
Lynn's.
I brought them in today.
So she brought them in. So I'm going to move up toward the camera here. You probably lose my head, but is it right here? Yeah.
It's inside
So
the flap.
if you can see, try to arrange it there. That's too close. Sorry if I'm getting too close for everyone there, but that's basically the normal pill vial label that goes on the pill vial we put inside the box. Now Mary's question here is about the PI, that prescribing information. I
Okay.
used to do a lot of printing in the pharmaceutical business, so I know all that stuff. But a PI is tiny, tiny, tiny print. So your question, do we offer that in an accessible format?
Yes.
I wish I had an answer for you. I'm going to say at this point, we probably don't, because that doesn't come from us, it comes from the pharmaceutical company. So I'm going to have to look into it, though. That is a phenomenal question.
But if you have a KNFB
Yeah.
reader or an OCR reader, you can read it.
That is a great question.
We'll look into that further.
I've never been asked that.
Does anybody
That's
have
thinking
any
outside the box.
questions,
I
any
love
other
that.
questions?
But I also was thinking of people that don't have the technology, or don't know Braille.
Right.
Or don't have someone that is sighted that they know that could read it. I'm sure that we could read it to them over the phone.
Uh-huh. Okay.
Anything else? Any other questions? David, we all set? I don't know.
Okay, well,
Thank you.
nobody
Thank
has
you
any
so
other
much.
questions?
I
You want to
appreciate
leave your
everybody.
contact information. You want to give everybody your contact?
Everybody should have.
Thanks
I would
for
probably
joining us.
just say, well,
Yeah.
yeah.
Lynn, why don't
All
you go
right,
ahead?
so PMC Pharmacy's number is 215-922-2502. And then I like to talk to people myself also. So when you call PMC at that number, you'll be talking to our fabulous staff who work with all of our customers. But if it's someone who's visually impaired, I would really like the honor of talking to them and explaining it to them. So I'm going to give you my contact information. So my name is Lynn, Lynne. Last name is Mayleaf, M as in Mary, Aleeeff, like Frank. My cell number is 267-481-5150. So that's 267-481-5150. And my email address is Lynne, Lynne, 423@gmail.com. And please don't hesitate to reach out to me for even the smallest question, because I'm passionate, we're all passionate about this, and would love to share any information you need.
And my information, my name is Greg Guinee. It's a tough one, so I have to spell it for you. It's Gregory, Gregory, .GUINETTE at PMC, RX for prescription.com. That's my email address. And our website address, and I highly encourage everybody to go to our website. The first tab goes right to the visually impaired section, and it's all in big bold print. We made sure it's very accessible, and that is www.pmcrx.com, and all the testimonials are on there, all the explanation of how the system works, and a lot of other information on a lot of the other programs we offer. We have a hospice program. We have a program for, as I said, pain management, lots of other things that we're doing.
And
It's a tremendous
also,
resource.
it's, sorry to jump on
No,
you that,
go,
but
go.
also when Greg said it was accessible, we made sure that it's good for screen readers. So I tested it myself.
That's it. Everybody, thank you very
Thank
much.
you.
Okay, that's it. Thank you, everybody.
Thank you.